Good evening, friends. I am Dr. Tushar from Apollo Spectra Hospital, Chembur. In recent times, during the COVID pandemic, there have been many patients who have been coming to me asking me certain questions and queries related to fever. So, I would be highlighting certain queries and I am trying to solve certain myths related to fever over here. So, the first thing is what you need to know and do when you get fever. So there are a few basic things that you need to do. One is you need to consult your healthcare physician so as to get to know the cause of the fever. Secondly, you need to do certain basic blood parameters like CBC, CRP, test for malaria, typhoid, or for that matter even dengue to rule out the cause of fever. Not forgetting that because this is a COVID pandemic going on, the priority has to be to rule out the occurrence of COVID-19 disease, because as we all know, COVID-19 disease presents with fever, cough, breathlessness, weakness, body ache, and so on and so forth. So the first and foremost test that needs to be done if you get fever is a COVID-19 RT-PCR assay. Second thing to note is there have been many patients asking me whether I should go for a CT scan of the chest early on in the disease if I am getting fever. So my answer to it is no. Early on in the disease, CT scan will not give any useful findings or any useful findings in the lung parenchyma that will determine the severity of the disease. So early on in the disease, getting a CT scan should be avoided unless you are having symptoms of fever along with breathlessness and drop in your oxygen saturation level. There is one more question that has been persistently asked to me by my patients. Post-vaccination, if I get fever, what do I do? So post-vaccination, there have been many cases which get fever for 1 or 2 days and fever associated with body ache, weakness, fatigue. So after getting vaccinated, there have been many cases which present with fever, body ache, and fatigue. My recommendation to such people is that you need to take a low dose of an antipyretic like paracetamol to tide away with the fever, because this will be a temporary fever for 1 or 2 days which will go away with time. There has been one more question that has been persistently asked to me by my patient, that whether we can start steroids in fever because I am scared. I am worried that my COVID-19 disease may flare up. I may get moderate to severe disease. So taking steroids per se for fever should be avoided, especially early on in the disease. Fever associated with breathlessness and decrease in the saturation, these cases need to be put on steroids, especially injectable steroids. But early on in the disease, and taking steroids in asymptomatic people or in patients who are having low-grade fever should be avoided. Thank you.